Hello everyone, before the video starts, as your doctor, I prescribe you to join TinglyTube, which is my own platform for uploading and watching ASMR videos. Every ASMR video I make, just like this one here, I upload 5 days earlier on TinglyTube. I also sometimes make and upload exclusive ASMR videos that you'll only find on TinglyTube. Another thing is, there's no video ads on the videos. The only ads we use are banner ads on the side of the page, so you're not going to get woken up when you're trying to listen to an ASMR video by an ad about the new Buick. So if you'd like to join, you can do so by following the link in the description or going to tinglytube.com. Again, it is 100% free to sign up, watch videos, watch other people's videos. You can also upload your own videos. Don't be nervous, upload your own video there. Thanks, and enjoy the video. Hello, and welcome. How are you doing? It's great to hear. I'm doing fine myself. So assume you had a good holiday season. It's great to hear. Definitely some people, they think the holidays are horrible. I mean, I guess as an adult, yeah, especially if you have people to get gifts for, but I don't know, I mean, just the spirit of it, just kind of the feeling of it. I do like the holidays, so it's good to hear other people also like them as well. So, as you may know, what today's just going to be is just a general checkup. At the beginning of the year, just like to do a general checkup just to make sure that everything is good with you, and if there isn't anything that's good, that we can catch that early on and refer you elsewhere to get treatment. So the first thing that I'm going to get started with is I just want to ask you a series of questions to just understand if there have been any changes since your last checkup last year, and now it just helps with kind of creating a start for the year to see kind of where we are now as compared to where we were last year, okay? Okay, so has there been any change in your personal habits? This can include smoking, diet, or alcohol use. Okay. No change. Okay. And included in change, that can, just be anything. Can it be changes in job or, living environment, anything like that, because really any, even small things can really have a change and effect on our health, so it just helps to know if there's been any kind of change there. So, are you currently exercising at least 3 times a week? You'd like to hope so? Okay. I'll just do a yes on that. Obviously, with the winter weather, that might be a little bit hard. A little while ago, actually just a few weeks ago, I was walking down the street and I seen there's like a local sneaker club, and they like run every week, and they were running in shorts. So I guess for some people the winter weather doesn't really affect them, so I guess more power to them. So with allergies, have you had any new allergies diagnosed, or any reactions to any new drugs? No? Okay. Now, have you had any change in your regular medication, or have you been prescribed any new medications? No. And have you had any significant illnesses since last year, your last checkup? No. Okay. Now, since your last checkup, have you had any hospitalization or surgeries? No? Okay, that's very, very, very great to hear. Now, with your family medical history, have there been any developments in that? Have you found out anything? Have, for example, your parents or siblings, have they gotten in any disease or anything like that? Have they gotten sick? No? Okay, that is very, very, very good to hear. Good to hear as well. Kind of a weird question, but obviously we don't expect you to, keep a track of if there's been any developments in your family health history, but just by that we mean, has your brother gotten sick? Has your sister went in the hospital with anything? Has anyone in your family gotten diabetes recently? Because that can help us pinpoint things as well. So, just as I said before, have there been any changes in your social history? So work, home, or family environment? No? Okay. Sounds good. So, next is just a systems review, and this is just kind of questions about just different systems of your body, just to see how those are doing. So, under constitutional symptoms, yes or no, have you been feeling in good health lately? Yes. Have you had any recent significant weight change? No. Have you been experiencing any unusual fatigue or weakness? No. And have you been experiencing frequent headaches? No. Now onto your eyes. Have you had any change in your vision recently? Have you experienced any blurred or double vision? No. And have you endured any kind of disease or injury to your eyes recently? No? Okay. And do you wear glasses or contact lenses? Okay. Now, onto your ear, nose, mouth, throat, and neck. Do you wear any hearing aid? No. Okay. Have you experienced any loss or ringing in your ears? And have you experienced any earaches or drainage from your ears? Have you experienced any chronic sinus problem or runny nose, every day or anything like that? No. Have you experienced any nosebleeds? Any sores in your mouth? Any bleeding gums? Yeah, we're getting into dental questions too. Have you experienced any sore throat or hoarseness or any change in your voice? Okay, no. Any lumps or swollen glands? Have you noticed any of those in your neck? No? Good. Any difficulty swallowing? Any neck pain or stiffness? No? Okay. Now onto your respiratory systems. Have you had any chronic or frequent coughing? Any coughing or spitting up blood? Okay. Very good. Any shortness of breath? No. And have you had any asthma or recurrent wheezing? No? Okay. Now, in your gastrointestinal, have you had any loss of appetite? Have you had any change in your bowel movements? Okay. No? Any nausea or vomiting? Have you had any painful bowel movements or constipation? No? Okay. That's good. Any frequent diarrhea? No. Any rectal bleeding or blood in your stool? No? Okay, very good. Glad to hear. Any stomach or abdominal pain or heartburn? No. Any black or tarry stools? No. Okay, and on to cardiovascular. Have you been diagnosed with any kind of heart trouble? No. Have you experienced any chest pain or do you have angina? No. Any abnormal heart palpitations? No. Any shortness of breath while walking or lying flat? Have you had any swelling in your feet, ankles, or hands? No? Okay. Now, have you woken at night with any shortness of breath? No? Now on to genitourinary. Have you experienced any frequent urination? Any burning or pain while urinating? Okay. Any blood in your urine? Have you had to change your force, or have you been straining when urinating? No? Have you had any urinary incontinence? And you haven't been experiencing any pain in that area? No? Okay. Great. So, you'll be happy to know that those questions are over. I apologize for how many there were, as well as some of them definitely being a little bit personal. However, again, yeah, we just want to make sure that you're okay and get as much information about you so that we can help you. So, we're now going to move on to the actual checkup. So I guess, in a way, this could be the fun part, because all you have to do is just sit there and I'll give you the instructions. So the first thing that I'm going to be doing is checking your heartbeat with my stethoscope. So what I'm going to do is, as you obviously probably know from your last checkup and other checkups, I'm going to check first your front heartbeat, kind of move around there, as well as check it on your back, okay? Okay, so let's get started with that. And just breathe normally for me, okay? Okay. Yep, just breathe normally. Nothing to be nervous about. Okay, you're doing great. Okay, so everything sounds good in the front. I'm now going to move on to checking you in the back, okay? Okay. Okay. Yeah, just normal breathing. Okay, you're doing great. Okay. So yes, everything sounds good in the heartbeat department. Not noticing anything weird there. Sounds normal. So yeah, everything, the heartbeat sounds good. So the next thing that we're going to do is check your pulse. So we're just going to be using this. We're not going to be using the fancy machine because this works just as well. So we're going to be doing right arm. Okay, sounds good. There we go. I just don't like it clinging around on the front of my chest. So, and I'm just gonna wrap this around your right arm. So, pull up your sleeve. Thank you very much. Very, very, very much. Okay, good. So, this right here is the meter, and this is going to tell me what your BPM is. So, I'm going to use this to start inflating it, and you're definitely going to feel some pressure when I start inflating it. However, if it starts to get unbearable, please let me know, and I will stop right away, okay? Okay, here we go. It takes a second for it to start getting up. Okay, there we go. Release all the air. So, you were about 150, which is pretty good. You're not in the red, and you're not dead, so those are good. So, now I'm just going to take this off. And then release the rest of the air. So, like I said, your pulse was 150, which is good. Again, you're not in the red and you're not dead, so you're doing good there. So the next thing that I'm going to do is I'm going to check your eyes and pupils with just a small pen light, okay? So I won't be blinding you with the sun. I'll just be using this. I'm going to take this off though. This is actually an otoscope, and the attachment goes on there. That way we can look in your pupils or ears a lot more closely. And if you take it off, it's just a pen. It's a little bit finicky though. There we go, it's a little bit finicky. So, just sit back and just gonna look in your eyes and it'll be over in a second, okay? Just try and keep your eyes open as best as you can. Okay, everything looks good in your right eye. Now moving on to your left. Okay. Now, another thing I want you to do is I just want you to follow the light, okay? Okay. Just a quick, simple test. Okay. Yeah, a lot of people think I'm giving them a DUI test. I'm not. I'm just checking your eyes. That way, in case I need to make a referral to an eye doctor. Yeah, that's all it is. So, the next thing I'm going to do is check your ears, and for that, I have the otoscope attachment. So, just gonna look in both ears. Okay, so first I'll start with your right ear. Okay, not very much wax, but you actually do want a little bit of wax in your ears because that does help keep dirt and dust out, bacteria. So, obviously, as you probably know, when you clean yours out with Q-tips, again, be very careful because, one, it can actually just push more earwax into your ear canal, and plus, someone bumps you or something, or you get scared, and you punch your eardrum out, and then you're, pulling it out of your brain, so obviously, be careful with that. Okay, your left ear looks about the same. Pretty good, pretty good. so both of your ears, they look pretty good. Don't notice any kind of abnormalities or any kind of alarm signs that something's off with your ears. You can hear me good, right? Okay, good. It's another test. There. Oh, you use one of those ear cleaning guns? Oh, that's cool. I've never seen them on TV. I've never tried them. Another thing I've seen on TV is those toothpaste dispensers. I always wanted one of those. I don't know, they just seem pretty cool. I don't know how they work, but I guess it's, pushing down on the tube somehow, or like compressing it somehow. I'll never know, I guess, unless I decide to get one. But anyway, besides that, I'm now going to check your reflexes. So, just going to check your reflexes for your knees, shoulders, and elbows. And for that, I'm just going to be using my otoscope. It's not going to break or anything. I'm not going to be doing it super hard. So, just sit with your knees, just try and relax them, because with some people, they kind of feel that when I do it, that they've got to kick their leg up. Don't kick me in the face. Just let your reflexes do it, okay? Okay. Don't try and force it, just be relaxed. So, check this knee. Good. Good. And then your other knee over here. Good. Good. Now I'm going to check your shoulder reflexes, so just try and loosen up in your shoulders. Okay. Okay. Good. Good. Okay, so your shoulder reflex there is good. And then let me check this one. Good. Good. Now, I'm going to do the same again, but with your elbows, okay? So just try and loosen up there, okay? Okay. Good. 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 Now this elbow. Good. 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 Okay, so your knee, shoulder, and elbow reflexes. Very good. You loosened up. Good. So, thank you for that. So, after that, you are done, actually. So, I thought there was more things to do. Oh yeah, your height and your weight. Yes, that was done by the nurses. I was just thinking about that because sometimes, if they're busy with a lot of people here, because the first day that we start scheduling all the annual checkups, because we do them over a few weeks, and on most days we group like 5 or 10 of them, and on the first day we had like 15 people here. So I had to do it for a few of them because the nurses were checking everyone else in. So what was the height and weight? Thank you. Okay, so your height and weight is good, not too different from last year, if I recall correctly. I don't think you're gonna get any taller or any shorter, so you're fine there. So, like I said, you are done. Everything looks good. I don't see any reason to refer you to any other doctor. You're doing good. You're in very good health. You take care of yourself very good, and I appreciate that, and I appreciate you taking the time out of your day to come in. I'm sure you probably had to leave work early, but thank you for coming in. I really, really do appreciate it. And since the holidays weren't too long ago, as I did with all of my other patients that came in for their checkups, I just want to give you a small gift. Just a pack of Burt's Bees. First thing in here is some beeswax lip balm with vitamin E and peppermint. It's very good. As well as some body lotion with milk and honey as well. So you can have that, as well as this aromatherapy stress relief, eucalyptus and spearmint with essential oils, antibacterial, and gel. So you'll be styling with this good smelling hand sanitizer. Here, you want to take a sniffy? There, take a sniffy. So, yep, you're very welcome. And if you'd like, as well, in the waiting room there's also a coffee machine, as well as a fridge with some bottled water if you want any, okay? Okay. Thank you again for coming in. And if you need to talk about anything or anything related to your health, you can always call me or log into the patient portal online. You know how to access that, right? Okay. So, you passed with flying colors, so I'll see you next year if all goes well, okay? Okay. It's nice meeting you again, and have a great rest of your day.